I'm Olivia Keiser. I'm an assistant professor in epidemiology at the Institute of Global Health at the University of Geneva. I work a lot on infectious diseases, but also on the interaction between communicable and non-communicable diseases. Have a lot of projects in Africa and supervising also PhD students there.
I'm Sara Botero. Olivia is my boss, is the director of the Graph Network, and I'm Sara, the manager, just a medical doctor from Colombia. I have been living here for 3 years and working with Olivia all this time around.
I was approached by someone at WHO Afro with whom we collaborated already since several years. And when the COVID pandemic started, he asked us for support because he had a little team and they were responsible to do all the analysis for their member states, for the 47 member states of the African or WHO Afro region, to support with COVID-related analysis and giving recommendations to countries. And this was a huge amount of work, also for his team, but also for our team. And therefore, I was reaching out to colleagues to ask if we could kind of join forces and support WHO Afro together. So I reached out to a lot of colleagues at the university, but also from the master program in global health, students who could help us, and from the computer science department, but also people who are based in Africa, who work, for example, at ministries of health, and people also from international organizations who could support us with this task. So that was a bit the origin of the network.
It's a dream. We have been able to reach all this amount of people, and I think Olivia said everything. We bring together just people in the countries, ministers of health, universities, organizations, and if I have to define what is the story behind it, it's a dream becoming reality, led by Olivia and for a bunch of believers. So.
And from Sara, who was managing this big amount of people and kind of doing all the administration, calling for meetings, empowering the persons and motivating everyone. So what is the Graph Network? So I already told a bit about the origin, but what we are actually doing, I think we really bring together all these people, which is a very interdisciplinary team. It's a team of young professionals to do data analysis, to support member states, but also international organizations with epidemiological analysis, to support monitoring and evaluation. But we really try to involve as much as possible people from the countries. And so it's really kind of a growing community where we work together and hopefully reach together a common goal and dream. We certainly need more support. I mean, so far we had some kind of it was a bit a group of volunteers, and we got some support from organizations like WHO and UNAIDS. But I think the idea is really to have a big network, or to maintain this interdisciplinary network, but to be able to respond to various questions that people at ministries of health has, but also people in international organizations, and that we can basically grow together. But we also need to have kind of some support of a core team, for example, to guarantee the sustainability. And then we'll continue to work with interns, with students, and with people in countries, which was very inspiring. So I hope that just we can, maybe expand a bit the reach. I mean, we started with COVID, but eventually then we did some work on HIV also. But we hope that we can also expand the disease areas that we're working on and the people that we're working with.
I think that we need to create a South-to-South platform. I'm not letting out the global North, but this platform of the South sharing knowledge with the South is one of the main things. So building capacities in the global North has a transitory role, but the capacities stayed in the Global South. I think that's our main goal. All these things that were mentioned by Olivia needs to be putting in practice in this big platform. So it could be a research platform, a training platform. So we want to build capacities that can stay at the local level, that the South can teach the South, and the intervention of the Global North can be transitory. So I think this is part of DREAM, so expanding to a global level, but where the Global South has a more active role.
I think it's also a springboard for scientific careers. So, I mean, many of our network's members, they are now working for international organizations, or they became even global leaders, for example, at WHO, and we hope that this will continue to grow.